This is Frances Russell, and in this module, we will review point-of-care ultrasound scanning technique for the eye. So if we were to look at the eye with the ultrasound, we would have the ultrasound transducer over the patient's eyelid, indicator towards the patient's right. And the first thing we would see if we were looking at a transverse view is we would see eyelid or soft tissue. You can see cornea here. It's going to be brighter white. Our anterior chamber of the eye is going to be black or hypoechoic as fluid appears black on ultrasound. You can also see iris, pupil, lens. So the lens is also going to be hyperechoic. You can see vitreous body, which is going to be anechoic, and the retina sitting at the back of the eye. And then you can also see the optic nerve and optic nerve sheath. So to evaluate the eye, you're going to want to use the linear transducer. This is a high frequency probe, so it allows you to differentiate structures that are superficial easier. You're going to notice your probe indicator here on the left side, and you'll want to have your probe indicator facing towards the patient's right if you're looking in short axis view. So here we're taking our linear transducer, we're placing it right over the eyelid. We're having our indicator facing towards the patient's right, and this is giving us a short axis view or transverse view of the eye. If we were then to do a vertical view, you'd rotate the indicator so it's up towards the patient's forehead. Importantly with the eye, you don't want to use a lot of pressure, so you want to use a lot of jelly, and you also want to rest your hand on the patient's face or nose to be able to stabilize the probe. So here's an example of a normal eye, and I'm just taking the transducer and fanning all the way through the eye. So you can see anterior chamber up here. As I'm fanning through, you can see pupil, iris, lens, or vitreous body, so it's black or hypoechoic. You can see retina at the back of the eye, and you can also see nerve coming in, which also appears dark on ultrasound. Using ultrasound, you can also assess for extraocular movements. So holding the probe over the patient's eye, just simply ask them to look left or right. If you have it in a vertical orientation, you can have the patient look up or down. Again, you can see anterior chamber, you can see iris quite well, and you can see vitreous body. Important thing with looking at the vitreous body, this is where you're going to look for any evidence of a retinal detachment, vitreous hemorrhage, or vitreous detachment. In a normal eye, you see that it's black, it's anechoic, there's no echoes within it.